Hi everyone, my name is Dr. Payel Gupta and I'm an allergist immunologist working on the Upper West Side.
I'm Dr. Natasha Keenan. I'm an ENT surgeon over on the Upper West Side as well.
So we're here together today to kind of give you some information on why ENT and Allergy Associates is all over together. We have 40 different offices, and the reason that ENT and allergists work together, we're basically going to talk about that today.
Right, yeah. So I have the sinuses here.
Yep, as a surgeon, we figured Dr. Keenan could talk about what the sinuses are and how allergies play a role.
Yeah.
Yeah.
So we all have 4 pairs of sinuses. What are the sinuses? They're basically air-filled cavities in your head that are lined with mucosa that make mucus. And there's different theories, to make mucus to humidify the air before it goes into your lungs, to warm and humidify the air, or to help with resonance of the voice, to enhance our voices, or my favorite is as shock absorbers to protect the brain if you fell on your face. So we're basically airheads.
Wow, I didn't know that. Actually, I didn't.
So we have the frontal sinuses behind our forehead. We have the maxillary sinuses. These are blue here, behind the cheeks and under our eyes. We have the ethmoid sinuses between the eyes. And then there's the sphenoid sinus smack in the middle of your head, and that's all the way in the back. So we have 4 pairs of sinuses. And they all have these little holes, ostia, doorways. They're tiny little holes that drain the mucus into the nose. So they can get blocked from different things, from inflammation, allergies, and then mucus can accumulate in the sinus cavity.
Okay, so basically the sinuses are producing fluid, and that fluid can't drain through the ostia, then it causes sinus infections?
Well, yeah. Because the fluid builds up, and there's nothing that bacteria love more than stagnant mucus. And then you can get infections, which leads to more inflammation and more swelling, and the ostia get more clogged and more closed, and drainage is impaired even further.
And we know that allergies are a big cause of inflammation in the nose, and that inflammation leads to that ostia being plugged.
Right.
So essentially, allergies, as we know, are allergies lead to inflammation in the nose, and that's caused by a chemical or compound that's released called histamine. And when that chemical gets released, we produce a lot of mucus and swelling in our nose, and that constricts the ostia. So people will come in to me complaining about sneezing, runny nose, and then we'll do the testing, we'll find out that they're allergic, but when I examine them, I also notice sometimes that they have this tissue called a nasal polyp in their nose. And when I see that, I definitely refer to Dr. Keenan, because that tissue sometimes needs to be surgically removed if it's blocking too much of the nasal passage.
Right.
So can you talk a little bit more about that?
Some people, not everyone, but some people, in response to the inflammation, their mucosa swells to a point where it forms this growth, this abnormal, benign, but mass of mucosa. And with time, with gravity, with sneezing, it can start to hang like grapes, and this further blocks the nose and the sinuses. And generally, people with nasal polyps will have congestion, runny nose. 75% will have like a decreased sense of smell, and sneezing, and they think they have allergies.
Right.
They come to you,
They think
see
they
the
have
polyps,
allergies,
right? Or they come to me
because they have sinus issues,
Yeah.
or because they can't smell.
Right.
So there's a lot of kind of overlap between what we see every day. And most patients who have chronic sinus issues should probably be tested at least once in their life, just to make sure they're not allergic. And the reason it's so important is because we know that treating the underlying cause, so treating the allergies with maybe a nasal spray on a daily basis, it really depends on what you're allergic to. But if you're allergic to your pet, we can do different environmental measures like getting an air purifier, using the nasal spray daily to control that inflammation, and then also, depending on how severe the symptoms are,
removal, right?
Sometimes doing allergy shots too, right? Allergy shots can help make the person not as reactive to those allergens. And so essentially our goal is to keep those ostia open so that we don't have the sinus infections and the sinus disease, so that people don't feel like they're constantly getting colds, right?
Yeah, so and if the polyps are removed, and they can recur if the underlying problem isn't addressed. And a lot of people do have allergies and they just don't know it.
Yeah. And so with our nasal polyp patients, we know through research that putting them on allergy shots and kind of getting rid of that constant inflammation allows the nasal polyps to not come back as frequently. So it doesn't mean that we can cure the nasal polyps, but at least the time period between their regrowth,
right? And improves the quality of life. Less congestion, improved smell, less sinus infections, and so forth.
Yeah. So it can decrease, and ultimately our goal is to decrease the use of antibiotics, decrease the use of oral steroids. So if we can prevent the symptoms and the inflammation, right? If we can prevent the inflammation, then we're ahead of the game, right? And we can prevent the infections from occurring. So that was basically what we wanted to talk about today. Although actually I thought of one more thing. You also refer patients to me because the patients are having chronic sinus disease.
Right, and they sometimes don't have allergies, but or they're on maximum allergy therapy or whatever, and they're just getting multiple sinus infections, throat infections. Even relatives might have a lot of infections too, and you wonder if there's some kind of underlying immunodeficiency of some sort. So I'll refer to you for an immuno workup, which is more common than people realize.
Yeah, so there's one common cause, which is called the common variable immunodeficiency, and that's diagnosed usually in adults. But they've been having infections since childhood, but they just seem like normal infections. They might be having the ear infections when they're younger, then maybe they had one pneumonia here, one pneumonia there, and it was just kind of chalked off as a bad flu season or, just, and then all of a sudden they'll just have sinus infections where we need to treat them with multiple antibiotics
over and over.
And so essentially what we do is we look at their immune system and we check to see if they're able to respond to if they have the right kind of factors in their body that help fight infections. So we test their immune system for strep pneumoniae, which is a common bacteria that we're all kind of faced with. We're vaccinated for the streptococcal pneumonia when we're little, and so we should be able to fight it. But when we look at their blood work and we see that they're not fighting that infection as well as they should, sometimes revaccinating them will help, or sometimes they need to be on further therapy, depending on what we find. So, there's a lot of different things that can happen with the sinuses that are related to allergies or the immune system. So Danielle, I know you're behind the scenes. Do we have any questions?
One question we do have, so if somebody comes and makes an appointment with Dr. Keenan and she decides, oh, you know what, let's send you some allergy testing, is that something that happens at ENT all in one day? Please talk about how, being that you guys are offices away from each other, exam rooms away from each other, how that's a benefit to the patient.
It's usually very convenient to have you down the hall.
Yeah.
Because a lot of times people, they take time off their, out of their work and to come to get examined. And when I look in their nose, I'm pretty sure that there might be an allergy component. I can, just send them to Dr. Gupta.
Yeah. So at ENT and Allergy, the great thing is we are together every day, and so we can see patients the same day. We can add on appointments. So if Dr. Keenan sees someone, they can come and see me. So that was essentially, the comment was.
And then, so if I notice I'm feeling more sniffly, runny during the day, is there a deciding factor of how I know, okay, it's an allergy thing versus maybe a nasal polyp thing, or is there a deciding symptom or factor that I should be looking out for?
should we repeat the question, Danielle?
Yes,
Or,
I don't know if they can hear me.
Yeah, so the question is if someone's feeling sniffly, sneezy, now it's kind of confusing. Should you go and see Dr. Keenan first, or should you come and see me first? And so essentially, really that's why we exist, because usually you probably do need to see both. And if you see one or the other, we can kind of help figure it out. Like, for example, if you have a new pet and all of a sudden you're having symptoms of sneezing, runny nose, all these things out of nowhere, then maybe coming to me as an allergist first to see if you're allergic to your pet would make sense. If you've had sinus issues where you've needed antibiotics,
Right, if you're having headaches, facial pain,
Yep.
Extreme fatigue, although I think allergies can sometimes cause fatigue too, but or thick yellow-green discharge from the nose consistently throughout the day, not just in the morning glow, but then you might want to come in and be evaluated for a sinus infection. A lot of it depends on the length of time that you've had the symptoms, the severity of the symptoms. So it's it's putting all of that together that helps us give the best treatment, I think, that's available.
And then again, if you see Dr. Keenan and she thinks you need to see me, then you kind of see me. And if I see you and I think that you need to see Dr. Keenan, you kind of see the other doctor. So you're really not going to go wrong booking with either one of us.
So back to school is around the corner. You walk into Walmart, you're seeing your book supplies. Do you have any tips or tricks for parents, getting their kids school ready? Do I get them food tested? Do I see an ENT? Do I make sure their hearing is right? Do I get, any tips or tricks for going back to school and being prepared?
So going back to school,
I think for me, for children, if they've had ear infections and a lot, or you want to make sure that they can hear well. So, coming in and being evaluated for effusions, it'll hear like mucus that gets stuck behind the eardrum can cause a conductive hearing loss. So, so if your child is not responsive, like has the TV way up really loud, or has had a lot of ear infections, I would say to bring them in for a hearing test to be evaluated before school starts, so that that they can hear well.
That's a great point.
Yeah. So otherwise, I think that it's really if you're symptomatic in terms of congestion.
I think for allergies, we also see, so as an allergist, I also treat asthma. So back to school means getting ready for asthma too, right? Or filling out those school forms. So if your child has a history of allergies or asthma, usually the school has a form that you need filled out to kind of get them ready for the medications that they might need while they're in school. And the fall time is a huge time for kids to get allergies from all the weed pollen that comes out during the fall. So allergies kind of are pretty prominent, especially right around when school starts. So I think it's a good time before classes start to kind of come in, touch base, see how the summer went, see if you have any questions about your child's asthma, allergies, all of that stuff, do it before classes start, before things start getting kind of hectic.
And I know we did just talk about back to school, but swimmer's ear. It's still July. Kids' ears are just filling up with water. How do parents fix it, make them more comfortable? When does it get to a point where, okay, you need to come in and see somebody, or, shake your head?
So swimmer's ear is usually refers to an ear infection of the canal. And that's when water gets stuck. And typically, water can get stuck behind wax. And if the water sits there, kind of like we talked about, bacteria love stagnant pools of mucus and water, you can get an infection, and it's pretty painful. So generally, antibiotic eardrops will be prescribed, but it's very important to get the wax out. So if that doesn't come out, you're going to keep getting swimmer's ear. By getting the wax out, generally that opens up the canal, lets it drain, and that's a big part of getting better.
Are there anything parents should be looking at, like kids tugging on their ear or, rubbing their ear? Are there things that they should be looking at to make sure, oh, okay, my kid's not verbally telling me that his ear hurts, but these are little things I should look for?
Right. If a toddler or child who is pulling on their ear a lot, it could mean that they're not hearing well from that ear, and there could be a wax compaction or a middle ear effusion fluid behind the eardrum that's causing them to feel clogged. So yeah, if you see a behavior that's not typical for your child, that might be a reason to bring them in to be examined.
And so back to school and camp is still happening, but say my kid was just diagnosed with food allergies, is there like essentials I should keep in their backpack, teach them how to, wipe stuff down, tell people that they have an allergy to a peanut?
Yeah, so food allergies are big, and that's also something that we see. So basically with food allergies, you have to make sure your EpiPen is up to date. You have to make sure the school has an EpiPen or 2 EpiPens at all times. So wherever your child is, there has to be 2 EpiPens, Benadryl, other antihistamines available for any potential reactions, right? And everybody that's taking care of your child needs to be aware of what your child's allergies are, and that's super important. And again, there's those school forms that you fill out with your doctor, and essentially you write on there all the food allergens and the steps that the caretaker needs to take in case your child is having a symptom at school. So, what do they do if they notice a little bit of itching? What do they do if they notice that your child is coughing after they eat or vomiting, or looks like they're having shortness of breath or having hives all over? So there's different steps and different things that we do for each of those symptoms. So, and obviously any of those severe symptoms, you're going to get the EpiPen. So, we outline all of that in the school forms so that everyone knows exactly what they need to be doing so that your child stays safe. As far as wet wipes, which is also a part of the question, obviously you need to make sure that whatever area that your child is eating on is clean. So if the school, a lot of schools now are like peanut free. So if your child is peanut allergic, you don't have to worry about buying wet wipes for a peanut free school, right? But if your child is going to a school where other kids might be eating peanuts, then yeah, wet wipes might be a good idea so that your child maybe wipes down the table before they start eating, so that the table is free of allergens. Sure. Yeah, that's it. Yeah, great questions. Thank you.
Thank you.
Natasha, that was fun. Thank you.
Do you want to plug your Instagram?
Sure. So I can be found on Instagram at NYC So if you have any other questions or want to follow some other tips and advice, you can always check me out there or at my Facebook page, Payel Gupta and
Thank you guys.